today on the Frontline Health Podcast.
We know there are two things that we can definitely do that help us even at a young age to kind of prepare our bodies for when we get older. The first thing is, if we listen to mom when we were growing up, when she said, eat your fruits, eat your veggies, and make sure you do that, then you're going to be that much further ahead by eating your fruits and vegetables and getting a good diet. The other thing you need to do is you need to avoid those processed foods that are out there. You also need to avoid a lot of fried foods because we know that processed and fried foods, for whatever reason, really seem to affect the prostate in studies that we've seen out there. Hello and welcome to this episode of the Frontline Health Podcast by Centurion. I'm Troy Duell, the CEO of Centurion Labs, and here's my co-host, Evan Patrick.
So for those of us who might have missed this day in health class or just weren't really paying attention, what exactly is the prostate and what does it do?
The prostate is a gland that wraps around the seminal vesicles. So what happens is as we grow older, actually it grows until about the age of puberty, and then from the age of puberty until about the age 40, it doesn't really grow at all. So once you get to about 40, it starts to grow. And as it grows, it's growing around those areas that really constrict things. It's almost like when a car gets on a hose and it stops the flow of water. Well, it's doing the same thing to your urine flow, and it causes issues with fertility and other things at that point as well. And after the age of 40, for whatever reason, and we think it's because of hormonal changes, that prostate gland just grows until we die.
It's really interesting because I don't know of like any other part of the body that is like that. I'm sure there are, but that starts growing at puberty and then stops and then starts growing again later on in life.
Yeah, I don't know either. I just know our ears grow our whole lives, but that's the only thing I know. Ears and nose, but then you got the prostate.
Okay, so you mentioned some health concerns already that the prostate is one of the most troublesome areas for cancer in men, but I'm wondering what other areas of concern are there for men's health when it comes to the prostate?
Well, obviously the biggest one that comes to mind is men as they grow older. One of the biggest issues you have is when you're sleeping, you tend to have to wake up because you've got to go to the bathroom more often, and you have more frequent urination desires because you're just squeezing the urethra as it's coming out. So you always feel like you have to go to the bathroom, and sometimes you don't get that complete voiding of your prostate or your urine flow that you're looking for.
So discomfort, sleeplessness, all those kind of things.
Yeah, and then there are other things that go along with it, like prostatitis. So you just get inflamed prostate. You have other issues, and those can be from bacterial infections. They can be from urinary tract infections. So it could be any number of things, but really the biggest one that the majority of men start to see is that inability to be able to sleep through the night or that increased risk of prostate cancer. I think some of those numbers are pretty staggering, and I have a couple of them here that I thought was pretty amazing. Under the age of 40, you have a 1 in 40,000 chance of contracting prostate cancer. Mm-hmm. But once you get to the age of 40 to 49, those numbers go to 1 out of 38. And then over 60 to 69, it's 1 out of 15 people end up getting prostate cancer. So those are the numbers that I think are kind of mind-blowing when you think about just age being the number one risk factor with cancer, prostate cancer in particular.
Yeah. So you're making me feel a little bit better as a guy in his mid-20s just about my risks with here, but you're saying as we get older, the prostate kind of becomes more of a trouble area for concern for men.
Absolutely. And, there's nothing really you can do from that standpoint because none of us can change the age factor other than die, which most of us don't want to do.
Yeah.
So we have to do our best with the certain factors that you can control. And we'll discuss those, I'm sure, a little bit later.
Okay, so I know you mentioned specific symptoms like discomfort, having trouble sleeping through the night, multiple bathroom trips throughout the night, and that kind of thing. But are there any other, warning signs that men can kind of look out for to know I might need to pay attention to my prostate health? Maybe there are some things I need to do. Maybe there's some medication. Mm-hmm. Like what do men need to look out for, especially as they approach their 40s?
Yeah, I think you can simplify it by, I call it the three F's and a B. So you're talking about frequency, which you already mentioned. So if you're having to urinate more frequently or get up in the middle of the night, that can be a sign that your prostate's enlarged and there could be an issue. But if you combine that with the flow, meaning that you're not able to get a full stream when you're going to the bathroom, or that you have dribbling afterwards, that can also be a sign that you've got issues. And then the final F of those would be feeling. So if you've got pain during urination or sexual intimacy, then that's when you know that there are really some big issues. And the final one, the B, it stands for blood. So if you have blood coming out at any time, you need to go right away. It doesn't necessarily mean that it's cancer, but it could be, and you want to get it taken care of right away because it could be just a bacterial infection. And that's something you want to get taken care of quickly, because even if you let a bacterial infection go, it can turn into something much worse.
For sure. Yeah. So here at Centurion, obviously a big thing that we try to encourage our listeners and our customers to do is to really take ownership of their health, to not wait until it's too long to address different health concerns, to get ahead of things and just kind of do what they can do and control what they can control to make sure that they're as healthy as possible in every area. So I'm wondering, how does that relate to prostate health? What can men do when they're young? What can they do as they age? Once they fall into the high risk age range, like for prostate health, what can they do to make sure that they can either prevent or help these issues once they arise?
Yeah, that's a great question, because we know there are two things that we can definitely do that help us even at a young age to kind of prepare our bodies for when we get older. The first thing is, if we listen to mom when we were growing up, when she said, eat your fruits, eat your veggies, and make sure you do that, then you're going to be that much further ahead by eating your fruits and vegetables and getting a good diet. The other thing you need to do is you need to avoid those processed foods that are out there. You also need to avoid a lot of fried foods, because we know that processed and fried foods, for whatever reason, really seem to affect the prostate in studies that we've seen out there. One thing that probably will hit hard for some men is drink less beer. We know that beer has an irritating effect on the prostate itself. So that's one reason that if somebody drinks beer or any alcohol, really, it wakes them up in the middle of the night because it creates that urgency and an irritant to the prostate itself. Mm-hmm. Then the other thing that we always talk about is diet and exercise. So we know that if you exercise, there are studies out there that show the more you exercise, the healthier your prostate is. But it's not just your prostate, it's any gland in our body. So it's really helping our lymph nodes and clearing out things within our lymph nodes. So exercise is just going to benefit you across the board.
Yeah.
And then we know that there are certain nutrients and vitamins that you need to be taking in. So supplementation is always a good thing, with specific supplements that you can take and really increase your health.
Okay.
Or prostate health in particular.
Yeah. So it's interesting that, some of the things you said, like nutrition, exercise, how they not only benefit your prostate health, but really every area of health. And it seems like that's kind of a common theme, as I just learn more about different areas of health, that like the more that you diet, exercise, sleep, the things that we know we should already be doing, but just kind of neglect at times, they could pretty much help every area of our health.
Absolutely. And I think that's one of the things when we talk about taking ownership of your health, those are the two easiest things we can do on a regular basis. If we eat right and we exercise, then those are things that are in our control that we can actually take ownership of. And if we don't do those things, it's not just your prostate health. We're obviously talking about that today, but it's every area of our lives. And you've got to start with the basics, which is exercise and eating right. Just taking those things into consideration and doing little things, simple things, are really what it's all about. You don't have to be every single day at the gym or right. A gym monkey, gym rat, as they like to call them.
Yeah. So it's interesting too, because I feel like I have a relatively healthy, clean diet compared to a lot of people. But then again, I will partake in the occasional taco mama or burrito, or I have my guilty pleasures when it comes to foods that I like to enjoy that are not
That's
healthy
right.
for me. But I feel like even with the healthiest diets that people can have, sometimes there are still those nutrients that we neglect. So even if we're eating super clean, sometimes it's hard. And you mentioned supplementation, so I'm wondering what types of supplements people can take to help with their prostate health specifically.
Yeah, there are a lot out there, and there's a lot of research that we found, but there are 6 ingredients that I'll touch on real quick that I think really, from studies and information, seem to have the biggest impact. The first one would be lycopene. So, lycopene is actually a part of the tomato plant, so it comes out of that. And they've had study after study that have shown how it has helped to reduce the size of the prostate and also helped with the long term prevention of prostate growth and potential prostate cancer. You've also got selenium. Selenium is a nutrient that's found in the soil. What they are saying now is that selenium has been kind of depleted with some of our farming techniques and other things. So it's harder to get in our diet. We used to be able to get it pretty freely if we ate lots of fruits and vegetables, and even in our meats, because they're eating the plants and other things that they get throughout their diet, which isn't passed along to us anymore. So selenium's a big one. They've actually done studies with the National Institutes of Health, and they have a health claim that says, hey, this is good for prevention of prostate cancer and a couple other cancers as well. So those are 2 big ones. Beta-cytosterol is another big one. It's actually naturally grown in the U.S., so the Indians used to use it for years. I don't know that they were using it for prostate health, but they were using it for inflammation and other things like that. But it also helps with prostate health. So those are 3 that I think you could look at that are really, really good and beneficial for you.
Okay. And so I'm interested in asking you about this. So we have a prostate supplement here at Centurion, Natrexa. We have a 30-day supply, 60-day supply. I know, as with a lot of our products, there's kind of a story behind the creation of that. So I'm wondering if you could tell us like a little bit about what's in Natrexa, how those ingredients will help people or help men with their prostate health, and then kind of like the story behind the creation of Natrexa.
Yeah, Natrexa was one of those that really came out. I had an uncle who suffered from prostate cancer. He was a great man, and he ended up dying from prostate cancer. So at the time, it was nothing that I was real familiar with, because most men under the age of 40 who aren't getting up in the middle of the night to pee aren't thinking about their prostate. It's
Right.
just not something that we do.
Yeah.
And I wasn't either at the time, but it came to mind, and I started doing a little bit of research on it and found that there were a lot of ingredients out there, natural ingredients, that can help kind of reduce the size of the prostate, potentially help prevent cancer, along with some of the other things that we do with our diet and exercise, that I was like, this is something that we could put together and get going. And we looked at all the ingredients that were out there and tried to get 6 of the most clinically studied and clinically proven ingredients at their levels and put it into the product to really try to benefit people's prostate. And it was all kind of started by just what my uncle had gone through.
Mm-hmm. So this is a part of a much bigger discussion that I don't want to deviate too far from prostate health. But you mentioned something that got me thinking. You mentioned the clinical studies that some of these ingredients go through and have gone through, that are that we have in our supplements and in Natrexa specifically. And what I hear a lot from people that I know who are in the medical field or kind of in that world is they're wondering, are supplements as effective as some other medications that they wonder about the studies and the evidence that there is of their efficacy. Could you speak to that just a little bit?
Yeah, I think it's like everything. I think it was Mark Twain who said there are lies and then there are damn lies based on statistics, right?
Yeah.
So statistics are true. You can have anything prove one way or the other.
Mm-hmm.
And I think we have that even within our prescription products, just like we have within the supplement products. So you do have to be careful. But what you want to do is take evidence from different sources that maybe don't have a financial interest in it and go, does this make sense? And you never want to rely on just one particular study, but you want to make sure that there are multiple studies that are backing it up. How many people were in the study? and making sure that it was a double-blind, placebo-controlled study. Those are always the best. And if you can find that information and compile it, then that's really the best way to make sure that the ingredients that you're taking are good. And I would never trust just a company, but I would take ownership of my health and start looking at those ingredients myself, make sure that it makes sense, and go from there.
Fantastic. Well, I, for one, feel a lot better about the future of my prostate health after listening to the things that you have educated us about in this episode. So thank you for sharing that, and appreciate it.
Absolutely. Thank you, sir. And thanks for listening to this episode of the Frontline Health Podcast by Centurion. For more information about prostate health or any other general health and wellness items, you can go to centurionlabs.com, where you can find out about safe, effective, and affordable healthcare products that we have made here in the U.S. And we'd also love to connect with you on social media. So you can follow us on Facebook, Instagram, X, and YouTube. And don't forget to like, share, and subscribe to the podcast so you never miss out on information that can help you elevate your health and life. Thanks for tuning in, and remember to take ownership of your health today, because no one cares more about your health than you do. Until next time, this is Troy Duell with Evan Patrick and Centurion, leading to make life better.